Anxiety is a natural human response to perceived stress, uncertainty, or a threat. It's important to note that everyone experiences it, but not everybody will have an anxiety disorder. Anxiety can be seen as simply an emotion that we feel, which manifests oftentimes physically as a response to excessive worry. It becomes a mental health concern, however, when worry, fear, or tension is persistent, overwhelming, and interferes with daily functioning. Anxiety is not a weakness, lack of faith, or failure to cope. It is the nervous system's response to staying in a prolonged state of alert. Identifying anxiety can be difficult, but also anxiety may present differently from person to person, which is the first thing I believe people need to understand. Common signs include excessive worry, irritability, difficulty relaxing, poor sleep, and avoidance of certain situations. In the Caribbean context, people may complain more about physical discomfort than emotional distress. They may say that they feel pressure, tight, constantly tired, or unable to rest their mind. Anxiety may therefore show up less as nervousness and more of a physical symptom, such as headaches, chest tightness, stomach problems, fatigue, feeling on edge. It's important to understand that anxiety can also affect concentration, relationships, and work performance. From a psychological perspective, anxiety is not a weakness. It is a learned response of the nervous system trying to keep a person safe in a world that often feels unpredictable. What can you do? First, respond with empathy rather than judgment. Avoid labeling the person as weak, lazy, or spiritually flawed. Listen calmly and take their distress seriously, even if you don't fully understand it. For someone experiencing anxiety, offer reassurance without minimizing their experience. Encourage rest, regular routine, and healthy coping strategies. It's often important suggesting professional help when symptoms persist or interfere with daily life functioning. Avoid telling them simply to stop worrying or pray it away, as this is not helpful and it can often increase the shame associated with anxiety. Treatment focuses on helping individuals understand their anxiety, calm their bodies and nervous systems, and shift their relationship with unhelpful thought patterns, and develop coping strategies that fit their cultural values and daily realities. Bipolar disorder is a mood disorder, identified by noticeable shifts in mood and behavior over time. These changes are not simply mood swings or personality traits. There are shifts in the brain's regulation of mood, sleep, and impulse control. How do you identify bipolar disorder? What I would first say is a mental health professional is the one to identify and diagnose this disorder. But for information purposes, during manic episodes or hypomanic periods, a person may sleep very little, talk rapidly, or have pressured speech, flight of ideas or racing thoughts, take risks with money or relationships, become unusually agitated or irritable, display inflated self-esteem or grandiosity, experience distractibility, increased goal-directed activities, and excessive involvement in activities that have a high likelihood of an adverse consequence, such as spending sprees or irresponsible business investments. On the other side of bipolar disorder is the depressive episode. So during these episodes, people often withdraw, lose interest in daily activities, feel hopeless, struggle with energy, and express thoughts of worthlessness. People may see themselves feeling drained or heavy or unable to work, or just a general disconnection from life. These shifts are not ordinary mood changes or mood swings and are not within the person's control. In the Caribbean context, manic periods may sometimes be misinterpreted as high confidence, excessive spirituality, stubbornness, or acting out, while depressive periods may be seen as a lack of motivation or laziness. From a mental health first aid perspective, the first aider is not required to make any of this diagnosis or spend time differentiating symptoms. A qualified mental health professional must make this diagnosis, as bipolar can be confused and misinterpreted as general stress, substance use, or personality traits, for example. What can you do? For someone experiencing symptoms of bipolar, consistency and boundaries are very important. During manic episodes, avoid arguing about their beliefs or behavior, but focus instead on safety, rest, and encouraging professional care. During depressive episodes, one can offer practical support, companionship, and patience. Do not pressure them to snap out of it. It's important to educate yourself about the illness and meet the person where they're at and ensure their safety. One can encourage adherence to treatment and support medication or therapy as prescribed. Involve trusted family members where appropriate, as family support is a key protective factor in the Caribbean context. Finally, recognize your limits. You are not responsible for diagnosing or fixing the person. If there is a risk of harm to themselves or others, seek immediate professional and emergency assistance.